Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Sarah Figueredo. She's the research and general director of the institute. How are you, doctor? How you doing?
Oh, very good, Luis. Thank you so much. How are you doing today?
I'm doing great. So we do have a couple of interesting topics, but we are going to talk about how the stem cells can actually help the chances of getting pregnant or any fertility issues that women have. In this case, doctor, does it work only for women or does it work for men as well?
That's a really good question because I was going to say that it is very effective in both genders. And because what the stem cells can do is they don't increase the numbers of the egg, or we call them gametes, the egg or the sperm. There is no direct effect of stem cells to the gametes, but what the stem cells do is they help with perhaps rejuvenating and regenerating the body so that perhaps men can create more sperm because of the after secondary effects of the stem cells. They can also help with, for instance, so in let's just speak about men right now, erectile dysfunction. So if there's any problems with in the erectile dysfunction area, then the stem cells can help with that and how it aids secondarily to conception. And then with women, it helps with actually in both sexes, it can help with regulating hormones in regards to the sex hormones, the gonadotropins as we call them, in order to aid fertility there. And then specifically in women, the stem cells can help with, again, rejuvenating, regenerating the body so that it is easily susceptible to getting pregnant. And then again, just sort of balancing the hormones and everything that's required for conception and getting pregnant.
But should I ask you what are the reasons that women have fertility issues and how the stem cells can actually help? So women that have these issues can know the reason why the stem cells are actually helpful.
Yes, that again is a very good question because it can be a very complex issue. Primarily in women, if it's not a structural sort of physical issue with the uterus and the ovaries and like a structural physical problem, it's most likely hormones and the fact that perhaps they don't make enough eggs in order for the sperm to fertilize the egg. And so what we aim to do with all the different adjunctive therapies is if it's a hormonal issue, we will supplement with the key natural hormones, bioidentical hormones, as well as growth hormone therapy. We also do the oxygen and the detoxification to get the body just ready for the stem cells in order to create an environment to conceive and to be fertile in order to carry a baby, basically. So we cover all the bases. So whatever the cause is, unless it's something major and structural or a uterus, a hysterectomy, or some women have major structural problems where they just cannot conceive. Unless it's something like that, we will cover all the bases in order to create an environment in the woman's body to carry a baby.
So we can say that the stem cells are like a natural healer that make up all the tissues in the organs. So that's why this will help the women.
That's right. That's right. So we apply the stem cells into the blood, IV, intravenously, so that the stem cells go everywhere the blood flows. And then if there is any kind of specific local issue, we will inject locally as needed. And we would need to investigate and do the workup as to what exactly a woman would need in order to conceive in the best, and again, like I said, to create the best milieu or environment for her to conceive. And so, and as I said, so if that's some oxygen, well, the oxygen will be there, but if it's hormone therapy and then just general regeneration with the stem cells, as you described very well, we will leave no stones unturned.
So what will be you mentioned the method of administration, right? So it can be locally or it can be through IV. Does this require like many sessions or just would it do it in one session?
You know, our treatment is so complete and comprehensive. It will last a minimum of 3 months, including the hormone therapy, the oxygen therapy, the detox, the stem cells themselves, and so. And there's a pre-treatment workup before a patient even comes for treatment to Guatemala. So we will do a screening for key dietary changes, key supplements. If we need, if it's a psychological or an emotional issue, which we address also, because we're a type of clinic where, again, we leave no stones unturned, because the body and the well-being of a person is not just their physical body. There's the emotions, there's the psychological, there's the mental, there's the spiritual, and we address everything. So it's really important that we address all of this pre-treatment, and they continue with the best, again, creating the best possible scenario to get pregnant.
I see. So, knowing all this, what would be the success rate for women after this treatment?
Okay, so if that's a really super question, because if the issue of fertility lies only in the female, and if we have and if it's a low number of oocytes or eggs that we are dealing with, if we address the problem endocrinologically, which means that we apply the correct hormones as well as the whole comprehensive treatment with the stem cells, and again, creating the environment of healing and rejuvenation, the success rate can be 60% or above.
I see. So it's a very good chance. I suppose you actually send a list of tests that women have to get done before getting the stem cells treatment done, right?
That's right. We do a complete workup and screening, including all of the blood tests and the blood work that we require in order to deduce the best approach for treatment. And then, as well as a medical history, we do a very thorough medical subjective history along with all of the objective. And then we go and create a treatment plan accordingly.
Okay, so there you have it, Foxy. If you listen to this podcast, you know that we are based in Guatemala. And what can we offer people that come to Guatemala, doctor?
That's again a good question, Louisa. What we do is when a patient comes for treatment, we include all of the comprehensive treatment package that I mentioned with the total detox program, oxygen therapy, in the form of either hyperbaric chamber or exercise with oxygen therapy, as well as any sort of appropriate hormone therapy and key supplements, as well as a stem cell enhancement formula or proprietary blend of key minerals and herbs to again create that environment for the stem cells to just hum along really well. And we also include accommodations for the patient and their companion and also family members, as well as a private driver so that the patient can get to and from appointments, airport transfers, etc. And then, of course, Guatemala is a wonderful destination spot with volcanoes and ruins, the Mayan ruins, coffee farms, and so there's a lot to see and do as well. So we help with organizing tours and things like that as well.
Excellent. So, doctor, is there anything else you would like to add to this podcast?
Just to reiterate that, so we address these issues in both male and female, and we discussed, I think, at a greater length with the female. So I'll just mention again that with males, we're dealing with the similar issues. If it's not hormonal, which we address, if it's structural with erectile dysfunction, we may inject locally as well as intravenously. And
With anesthesia, with anesthesia, right, doctor?
That's right.
Okay.
Absolutely. Yep. And in some cases, sedation, just so the patient is comfortable and that we can do everything we need to do without any discomfort to the patient.
Okay, so I think this is a very interesting topic. There's a lot of women out there trying to get pregnant, and stem cells can actually help. So if you know someone or if you are having these issues, so send us an email. At the end of this podcast, you will find all the information how to contact Dr. Figueredo. Doctor, I appreciate your time, and just a heads up, if you want to know what the whole thing about stem cells, what these stem cells are, or how they work, so don't miss the next podcast because that's what we are going to talk about. Doctor, thank you very much.
Thank you. Thank you, Luis. Wonderful. I look forward to our next podcast.
Okay, you take care, doctor.
Thank you. You too.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo. That is on YouTube. Thank you.